targeted towards helping people live a better life.
It's something we're all striving for. But for those who have been living with chronic pain, depression, and a lack of energy, quality of life is a relative term.
9 surgeries in 9 years. I had got to the place where I didn't want to get out of bed. I had severe pain, lack of mobility. I walked with either a walker or a cane just to try to function.
I was in a dark hole. First started out just drugs, every kind of drug you can think of, and all it did was make you more miserable. I was really skeptical, actually, because nothing's worked. Nothing.
These testimonials were taken by staff from the first group of patients in the state's only functional restoration program. Clinical psychologist Dr. Kevin Valls is co-director of the program.
For our patients, the average duration of pain is about 7 years. So these are folks who've had pain for a long time and have often had numerous interventions, injections, surgeries, other kinds of procedures to try and resolve the problem of pain. But for most of them, it just hasn't worked.
Functional restoration pairs a small group of patients to a range of physicians aimed at treating the body, mind, and soul.
It has a mix of physical therapy kinds of things, so people are up and moving or learning about different ways of moving. It has a bit of psychology in it, which is less about laying on a couch and telling me people's deep, dark secrets, and more of asking people to think very hard about how they're living their life and whether or not the things that they're doing are contributing to an adequate quality of life or not.
Co-director Dr. Evan Rivers specializes in rehabilitative medicine.
You can decrease disability, allow people to do more things, improve physical fitness, improve depression, improve anxiety, decrease use of dangerous medications like opioids and benzodiazepines.
The 6-week program consists of 2 full days a week of work in the clinic.
But we also think it's important for the people who participate in the program to go and challenge themselves at home in between the sessions too, because that's where the challenges really come up.
Using what they have learned, Dr. Valls and Rivers say they've seen their patients overcome difficult challenges and go on to reduce their opioid use, reconnect to others, and
they end up saying they are happier, they're more able to do the things that are important in their life. They are less exposed to these medications that can be harmful. And it lasts for decades for some of these folks.
Sound too good to be true? Let the patients tell you.
It's been, to put it very, very directly, a miracle for me. My pain ruled my life, and now I'm in charge of my life again.
For the University of New Mexico, I'm Alex Sanchez.